out of the blue, feeling perfectly healthy, working full-time, very active, and I had developed a cough. And at that time, I was due to go back and see my primary care doctor, and he said, well, let's go ahead and get a chest x-ray. So the next day when I went into work, I had gone for my chest x-ray in the morning. I'm an oncology nurse practitioner. I have access to the results of tests. It was probably about 5 o'clock that afternoon that I pulled them up. And as I started to read them, I just panicked. It described a 4-centimeter right lower lobe mass with some hilar adenopathy, which is an enlarged lymph node in the chest. Because I work in the field, lung cancer is always bad unless it's a stage 1. And when the biopsy report came back that it was primary lung, and it's something called a non-small cell lung cancer, an adenocarcinoma. And they determined it was stage 4 after looking at all these tests. So at that point, it was okay, what do we do? Stage 4 lung cancer, if I did nothing, my prognosis, about 6 months. With treatment, maybe a year. But when you have stage 4 lung cancer, you're not a candidate for surgery. You're not a candidate for radiation. So the treatments are chemotherapy, or some of the newer things that they do in lung cancer is a targeted therapy, an oral agent. If I don't have long to live, do I want to do chemotherapy up front and maybe only have a 30% chance of it working? There was a newer agent they were also giving along with chemotherapy called Avastin that is an anti-angiogenesis inhibitor, and basically what that does is break down the blood vessels of the tumor, keeps the tumor from growing. And I wasn't ready to say no more treatment, so I reconciled that I would do chemotherapy and that I would do it with this new drug Avastin. If I'm going to do it, why not do the best thing that I can for myself?
In health news, imagine this. You are battling cancer and at the same time fighting the insurance company about your course of treatment. It can happen to any one of us, and for Sharon Hines, it did.
A little orange juice.
A hot, hearty soup on a cold winter day has cancer patient Sharon Hines happily cooking in the kitchen. Sharon, a non-smoker, has lung cancer, but that has not been her only challenge.
I was totally stressed out by this.
Stressed out because her insurance had twice denied an FDA-approved therapy which her doctors had prescribed.
I cannot tell you the anguish, the despair, the anger I and my family felt. It was crushing. I could not comprehend that the insurance company had the right to deny treatment that was the standard of care. And suddenly, it wasn't the cancer that was to be the biggest battle of my life. It was the insurance company.
But as a nurse who specializes in cancer care, Sharon knew it was the right course of treatment.
It's because Avastin can actually prolong your survival. It also can delay the time to progression of your disease. And anyone who works in oncology knows that, but the people who supposedly are oncologists working for the insurance company making these decisions obviously were uninformed, misguided, whatever. I felt desperate. I was angry at them. You know, who are you to make a decision, deny me a treatment, a proven treatment that my own physicians are recommending, and that I personally know what the score is. We called the Attorney General's office. It was probably like 4:15 in the afternoon, and the woman who picked up the phone, I said, I want to speak to the Attorney General. She said, well, you can't do that. And I said, well, I need to speak to someone. This is an urgent matter about my lung cancer diagnosis and my insurance company denying me a treatment that has been recommended. Ralph had left, and at 8:30 he got a call from Assistant Attorney Tom Ryan returning our call about this insurance denial. And through his help and the Office of the Healthcare Advocate, He reviewed everything that we had pulled together. We submitted everything, I think it was like on a Thursday. Monday morning I had a call from Maureen Smith, and she said to me, "Sharon, the external reviewer has overturned the denial." I can't tell you the relief, the tears just flowed. I called Ralph on his phone, we just both cried on the phone. It was just, the anxiety, the worry, everything was like, okay, you know, if I'm willing to give this the best fight I got, then you guys got to too.
When you're facing cancer or cardiac illness or diabetes or other life-altering and life-threatening diseases, you need as many people in your corner as you can get.
That's going to be the argument.
Last year, Sharon Hines was among the more than 2,000 cases the office handled.
Connecticut is very lucky as well in that it's one of the few states that has an independent office like this. That doesn't work for the insurance industry, doesn't work for the insurance commissioner, and is really there to work for the consumer.
I mean, you always have to be your own advocate. That never stops. I didn't want someone else making that decision. You know, there's a greater power that'll make that decision, but not my insurance company.